Yeah, so hi everyone, I'm Giulia. I'm a PhD student in the Carandini-Harris Neurocomputation Lab. This is an introduction to doing acute recordings with Neuropixels. And generally, what happens during acute recordings is that you insert the brain before you record and you remove it afterwards. This is in contrast to chronic systems where the probe can get implanted and can remain for weeks and months. Now, I listed here some of the features of these two recording systems. With acute recordings, you generally only record in head-fixed animals and for a much shorter span of time compared to chronic recordings. However, you can fit many probes at the same time, so you can target multiple areas. And importantly, you can adjust the angle of insertion across sessions, which is very useful if, for example, you're interested in recording from the dendrites of neurons in the cortex and you want to be parallel to them. So these are some of the features that you might consider when you're about to start, and you need to choose whether you want to do acute systems or chronic preps. So I'm going to go through an example experimental pipeline for acute preparations, and you hear a talk by Salian after me, which would do the chronic systems. So with acute preps, you always start with the head plate implantation surgery. This is the procedure where you attach a metal plate to the skull of the mouse or the rat in order to keep the head stable during the recordings. The duration will vary depending on whether you couple it with other procedures like virus injections, but normally it's in the range of 1 to 2 hours. And I put here some tips on this slide, which will be online. The most important thing I would say is to make sure that you plan things ahead of the surgery, have an idea of where you want to insert the head plate, where you want to attach it, and make sure that you can see the areas you want to insert the probe in, and then you cover it. You cover it fully. Of course, also be rigorous during the surgery. Do everything you can to make sure that your animal will have a good post-op recovery. Prepare all the equipment you need ahead of the surgery, and of course, work under sterile conditions. One important thing is to protect the area that you expose. So the piece of bone that will remain exposed when you attach the head plate, as this can get infected. You can do this in different ways. You can use clear cement and apply a very thin layer, or you can use a head plate design like the one I put on the right, which features a plastic cap that can be screwed in. So on the topic of planning, you just heard the talk by Kenneth explaining pinpoint for planning trajectories. You can also use Neuropixels Trajectory Explorer by Andy Peters. One thing to keep in mind is that when you do the surgery, you want to think of where you're going to insert the probe, make sure the area is exposed, and so keep the future insertion and trajectory in mind when you do your head plate implantation. And another important thing is to have your landmarks. So make sure that, especially if you cover the skull with cement, you mark the area you're interested in, where you do the craniotomy later on with either a marker or a light scratch on the bone. If possible, you can also mark the main reference points on the skull, so Bregman and lambda, which is where the sutures meet, and that will help you out when you need to find the right spot during your craniotomy. So of course, once your animal has recovered from surgery, you normally handle it and habituate it to the rig. It goes without saying that habituating properly before experiments is not only good for the animal, but for the recording itself. You can imagine, for instance, that if your animal is not comfortable on the rig or with head fixation, the drift, the motion of the probe you might get will be much higher than with an animal that is calm and not agitated on the rig. So this is really important. And of course, the length will vary on your experimental needs or whether you need to train the animal on a particular task. And so it goes. Normally for us, it's a few days after it has recovered fully from the surgery. And up next after the habituation, you have the actual craniotomy. So this is the procedure where you remove the piece of skull that's above your region of interest. You remove a tiny piece of bone. This should occur at least 3 hours before the actual recording to make sure that your animal is fully recovered. It can also be carried out the night before, but keep in mind that from the time you remove the bone and expose the brain, the tissue will start deteriorating, starting from its superficial layers. So if you care about upper cortical layers or dendrites, you might want to get your first recording on the same day where you do the surgery. And the diameter of the craniotomy will vary, again, depending on your experimental needs. In general, smart craniotomies are good for single insertions because they reduce motion, they keep the brain in place, and of course, they expose less tissue, so you get less deterioration. But they might make access more difficult, especially if you want to try in different insertion angles. Whereas on the other side, larger craniotomies are good for multiple insertions. They will make access easier, but they will expose a larger portion of the brain, and you might get more probe motion. So these are all things to consider when you choose the diameter of the craniotomy. How do you do a craniotomy? Well, there's two standard ways. One is to use a dental drill with a diamond tip. The other one is to use a biopsy punch. I think the choice is up to you, to your personal preference. With biopsy punches, you can do the craniotomy under saline, which is good for tissue health. But dental drills, I think, allow you to have a more refined approach if you're starting and you're not really familiar with biopsy punches. But again, that's up to you. It's a subjective decision. I put some craniotomy tips. Again, this slide will be online if you want to come back to it later. My main message would be to not let the brain dry out during the craniotomy. Use sterile saline solution wherever you can, and also use dexamethasone where possible to prevent brain swelling. This helps a lot, especially with larger craniotomies. And don't remove the dura unless really necessary. There's a chance you might damage the tissue, and also it will grow back, so it can make insertions more difficult across days. So this is an important thing. Craniotomies should always remain sealed when not recording. You can use a combination of things. I put some examples here, like Duragel or a piece of gel foam. Quickcast works really well to protect the craniotomy between recordings, but it can be removed during grooming. So watch out if you're not single housing your animals after a craniotomy. And again, you can also use a plastic cap, which is the best solution because it's screwed in and then the animals cannot remove it, and your craniotomies stay protected. Now, this can be done before the craniotomy, but generally it's good to do a check before you start recording and do some sort of like probe and rig preparation. Flora has gone more in detail about probe sharpening. There's also resources that I'll put at the end. This is a very important and quick one-off procedure to get into the brain easily without compressing the tissue, without damaging the tissue. It makes things much easier. You only need to do it once. And again, it will also improve the quality of your recording. You can get temporary cortical depression sometimes with tissue damage or tissue compression. So this is really important. And I put here an example from Carolina's probe where you can see how different and sharp it looks after sharpening. The second thing you do after the probe tip has been sharpened is to coat it with a fluorescent dye. This makes it possible to find your insertion spot during anatomical reconstructions after you're done. And there's a very nice detailed explanation on how to do this with demo videos from the 2020 course. I like to do this using a fine pipette and then a very fine tip, and then trying to apply a few coats on the probe tip right before I start recording, but you can also do this a few days before. And yeah, once you're done with rig preparation, you're about to start recording, I think it's good to run through a few checks. For example, check if you have enough space on the acquisition PC, or if you have a good view of both your craniotomy, your insertion spot, and the probe. If you planned an angle insertion, you can use an inclinometer to set the angle of the manipulator, and it's a good idea to do a test run if you have time. And make sure that you have saline at hand to use across the recording so you can keep the brain hydrated and tissue happy. Now, before the recording starts, generally what you do is that you put the mouse, the animal, on your post, and then you move the probes towards the craniotomy using a micromanipulator. You set your 0.0 at the brain surface when you see the probe tip touching the tissue, so you know how deep you're gonna go during your insertion, and you add saline solution on top of the craniotomy. This is really important. When you insert the probe, make sure you proceed really slowly. I put this paper here showing that the quality and the activity that you get if you proceed slowly, as opposed to like going quickly through the brain, changes dramatically. So it's very important. I normally proceed very, very slowly, like 2 to 4 microns. You can also go up to 10. Generally, the slower the better. And once you do this, you'll see that the signal on your software acquisition, your acquisition software will change once you start getting spikes. I would still wait 5 to 10 minutes generally for things to settle, because the tissue expands once you insert the probe, and make sure that you reduce drift. So yes, once you're in, you might see something like this. This was a population activity around layer 5 in the mouse visual cortex. And so it will be clear once you start having spikes when you're in the right zone. Now, troubleshooting, there's different issues that you might encounter when you record. I put here 2 macro categories that are, I think, very common. One has to do with insertion and the other one with grounding and noise issues. For insertions, I put some tips here. I think the main thing is to keep an eye on the trajectory and sharpen the probe. That would be the best approach, but if necessary, of course, you can also remove the dura if you can't get through. Grounding and noise issues are generally trickier. My suggestion in that case, as Bill was saying, if you tried everything, is to check the Neuropixels Slack channel. Not only because often people have encountered similar problems before and posted a solution that worked for them, but also you can ask for help directly and you will get advice from the Neuropixels community. So if you've tried regrounding the rig and you check that the hardware is okay, I think that's a good place to go. And this is an example from Carolina, where you can really see the difference between grounding your probe properly and not grounding it, right, in the plot above. Right, after you're done with your recording, you generally remove the probes. Again, be careful with the speed, especially if you're planning to record from the same area again. You cover the craniotomy. You wait for the quick cast, for example, to settle, because it will remain kind of like liquid-like for a bit. So you need to wait a bit for it to settle, and then you free the animal from the head fixation post. Then you take care of the probe. You generally leave the probe in a solution that will degrade any tissue remains that are stuck to the shank. So you can use tergazyme, and you should then rinse it with water. You can also leave it in water until your next recording. That's also fine. For anything that's stuck to the probe, like any residue that has not come off, you can use a silicone cleaner like the one that I put on the screen. That also works really well, and it provides some extra help in keeping the probe clean. Okay, and then lastly, when you're done with all of your recording sessions, you would generally perfuse the animal, you extract and image the brain, and then you can do a 3D reconstruction, you will do your anatomical registrations, but there will be a talk about this tomorrow afternoon, so I won't go too much into detail about this. And then you're done with your acute preps. So I put some extra resources here. There's some great talks from the previous Neuropixels course. There's also an acute surgery example protocol in this paper from the Allen Institute. And again, the Neuropixels channel is really useful when you have questions, you're stuck on something on the rig. Had saved me in many situations. And I also put a protocol on probe sharpening that goes into detail on how to do this.